The beauty of social media is it gives you a chance to tell your stories without anybody in the middle filtering it. So, traditional media, you don't have to rely on traditional media. And traditional media is embattled right now. Newspapers don't have health writers anymore. They have somebody who's covering the health beat, 10 other things. So you have a chance through social media to communicate directly to the people who care most about your organization, who are your brand advocates, who can then go out and tell others, and that's the best kind of marketing you can have, without having to have anybody change the story or edit it or decide what's important or not. You get to determine how to tell your story now. Now, you lose control after that. It's in the hands of your supporters and those who don't support you. They're all going to talk about you, but it's such an amazing tool. If you'd asked me 10 years ago, if you described this tool to me, I would have said, no, that's not going to ever exist. It is a gift to marketers. Yeah, I think when it comes to developing a strategy, and that is number one in my book, being strategic and how you use social media, the very first thing is to assess your organization's culture and their willingness to get involved in social media. Because the last thing you want to do is get involved and have a Facebook group and be on Twitter and all of this stuff, and then the first time someone says something negative, your CEO freaks out and they want you to do something really reactive. So I think the first part is laying the foundation before you actually get too heavily into social media, to make sure your organization is prepared so that everybody's educated and they know, sometimes people are going to say something negative, and here's how we're going to react to that. And I like to let the group react for us rather than have the hospital have to react. Because one of the things I've found in social media is it's very democratic, and your supporters will jump in a second and defend you if somebody says something negative. And the beautiful thing about Facebook is it's not a very negative medium. People are there to like things, so it doesn't lend itself to negative comments. The most negative I've gotten on Facebook has been somebody saying, I've tried to get a job at that hospital, and I don't know what, you have to be an insider or something to get a job. I can live with that. But I think first, making sure your culture is right. Then my second step would be, make sure you listen first. Get involved in these channels and listen to what's going on. Watch, become a student of them before you just jump in head first. So follow. You can be on Twitter and not be tweeting. Most people on Twitter don't ever tweet. They just follow people and listen and watch. So educate yourself, become informed. And then finally, Carol really hit on this, this is just like any other marketing plan you're going to build. Same steps, understanding your target audience, understanding their habits. So it's not about you. You have to remember that. It's about them. So what media are they using? What social media are they using? You wouldn't run on a TV station that your target audience doesn't watch. If you're targeting a female demographic, for example, you wouldn't run spots on some station that's all male-oriented. So same thing with social media. You got to pay attention to what your audience is using. And if they're not using Foursquare, you're not going to use Foursquare. So really simple fundamentals. I think Carol nailed it. I think you need social media policies no matter what. No matter what your perspective is for your employees, because there are privacy issues for patients. There are all kinds of, your brand is at stake. For the first time, this is not just word of mouth, them being in the grocery store saying, oh my God, things are horrible at the hospital. I hate working there. This is them using a form of media to communicate. And it's there forever. It's searchable. I'm getting Google alerts, and if you aren't monitoring this stuff, you need to be monitoring it using a lot more than just Google, but that's a good foundation. So you need it. And I would just say, the only thing I'll add to this part of the conversation is, a lot of people have gone down this road already, so you don't have to start from scratch. You can go to the Mayo Clinic's website, for example, and download their social media policy for their employees. So you don't have to start from scratch. This is another form of communication that you have to deal with. And to me, the least important issue is their productivity and how much time they're going to spend on Facebook. The more important, the number one priority is privacy of patients. And then the second is protecting your brand. I love that you brought up the Facebook advertising. We do it for a lot of our healthcare clients, and it is the most cost-effective advertising we're doing right now. In terms of the question, who does social media belong to? This is like that big unanswered question. It depends on your organization, I think. It depends. where the skill sets live. No matter what, it needs to be integrated. You can't separate social media from PR, from advertising, from marketing. It all works together. So it has to be integrated throughout your organization and throughout your marketing. It's not this thing that lives off on its own. To me, that's a strange thought. I think the most important thing, I'll just use this opportunity to throw it in there, when you're doing social media, the way to make it successful is to repurpose content across platforms. I blog on Saturday morning, and then I time them to post throughout the week. There are tools, and every time a blog post goes live on my WordPress blog, it automatically sends a tweet. There are tools to make this really efficient for your organization, and I don't expect you to know all of them, but there are people out there who know how to do it, and they can spend, in very little time, they can teach you how to do it really efficiently for your organization, because it's the only way to do it. Social media should not dominate your time. It's just one component of what your organization should be doing. I want to go back to ROI for a second. I will tell you, I think people who ask about ROI with social media, it's like asking what's the ROI on breathing. It's there, we need to do it. And I will tell you, it is the most measurable thing I do. ROI is different from being measurable, but for people who love metrics, man, you can bring them some metrics. I mean, if you have a Facebook presence, you should be getting an email once a week with your metrics. You should know whether it's male or female dominated, how many people came to your site that week, how many people did engagement things, like said they liked something or commented on your site. It truly is incredibly measurable. Twitter's the same way. Using Hootsuite, there's a stats section. You click on your stats and you can see which of your tweets were most popular, who clicked on what links, and so on. So it's incredibly measurable. The second thing is I want to reiterate what Sally was saying about how it all works together. So I call it the holy trinity of social media: Facebook, Twitter, and a blog. Those three things work incredibly together, because you use Twitter to promote what you're doing on Facebook, to promote what you're doing on the blog, and it all works together, and you can share content between all of them. And if you want to get out of the Trinity metaphor, you can go on to add YouTube in there, so you got 4 things. But the way this stuff works together, there's such efficiency and power in bringing them all together. My word of wisdom, God, what would I say? I think don't get caught up in what everybody's saying about social media. It is another tool, but it's a really powerful tool. And people will ask you really dumb questions because they don't understand it, and they're fearful of it. And it's your job to make sure people in your organization understand it. So the fact that you might have people in your organization who are resistant, that's a challenge. Bring them books, bring them articles, bring them case studies. You have to overcome that challenge. It's just an inherent fact. And you have to bring me over and educate me and inform me about why social media is vital to the business objectives of the hospital.